In 2016, William, Kate, and Prince Harry launched Heads Together, a mental health campaign built to tackle stigma and change how Britain talks about mental well-being. It wasn't an abstract cause for William. In a BBC documentary about mental health in 2019, he described losing his mother, Princess Diana, as a pain like no other, and Heads Together grew directly out of that experience, an attempt to make sure other people struggling with grief, anxiety, or crisis had somewhere real to turn. One of the campaign's most lasting achievements came out of that early work. Shout, the UK's first 24/7 text messaging support service for anyone experiencing a mental health crisis, launched in 2019 with backing from William and Kate's Royal Foundation. William didn't just fund it, he trained as a volunteer himself, vowing in 2019 to take shifts and following through the next year by anonymously taking calls and offering support alongside other trained volunteers. By March 2025, Shout had reached a genuine milestone, 3 million conversations. William marked the occasion with a visit to Mental Health Innovations in White City, London, the organization behind the service, which had recently merged with another charity, The Mix, to combine resources and reach more young people. During the visit, he heard from members of the charity's Youth Advisory Board about how the merged organization was using data science and AI to identify vulnerable groups across the UK and get help to them faster. Nearly a decade after Heads Together launched, William found a new way to reach people who might never otherwise engage with a mental health campaign: football. In January 2026, he launched Heads Up, an initiative using football's near-universal reach across the UK to spark honest conversations specifically about male mental health, a demographic long known for avoiding exactly those conversations. The campaign secured support from every major footballing body in the country. As a symbolic gesture, FA Cup third-round matches were delayed by 1 minute, with stadiums screening a 60-second film urging supporters to take a minute and genuinely consider their own mental health. It wasn't designed as a lecture, just a small, deliberately timed nudge aimed at a captive audience spanning every generation and background the sport reaches. For a cause built around getting men to admit, even quietly to themselves, that they're not fine, William's team bet that a football stadium might succeed where a doctor's office often doesn't. What's made William's mental health advocacy increasingly distinct over the past 2 years isn't just the campaigns, it's his willingness to talk about his own family's experience alongside them. In late January 2026, during an appearance in Bristol, William opened up with unusual candor about his own emotional processing, admitting that he takes a long time trying to understand my emotions. He extended that honesty to parenting, discussing how he approaches his children's emotional lives following Kate's 2024 cancer diagnosis and his own family's difficult stretch that year. It's a notable evolution for a royal family built, historically, around composure rather than disclosure. William has increasingly suggested that hiding difficult feelings from his children doesn't actually protect them, a philosophy that runs directly counter to generations of royal parenting built around restraint and privacy above all else. William's mental health work hasn't stayed confined to cities and football stadiums either. Earlier, he pledged mental health support specifically for tenant farmers on the Duchy of Cornwall estate, responding to a genuinely alarming statistic: one farmer in the UK loses their battle with mental health every week, driven in large part by rural isolation that rarely gets the same policy attention as mental health challenges in cities. That pledge grew into a broader partnership. William and Kate announced a new collaboration with Norfolk and Waveney Mind, a local mental health charity, to expand support specifically for rural and farming communities in northwest Norfolk, including, notably, communities living and working on the royal family's own Sandringham estate, where nearly half the local population actually resides. The program, launched in 2025 and funded to run at least 2 years, includes face-to-face counseling and drop-in sessions tailored to different groups, parent and toddler groups, menopause support groups, and men's groups specifically. Sonia Chilvers, interim CEO of Norfolk and Waveney Mind, said the charity was all too aware of the specific mental health challenges faced by people in rural settings, and welcomed the partnership with a couple she said know our Northwest Norfolk communities well. Looked at individually, these initiatives might seem scattered. A football campaign here, a rural counseling program there, a milestone announcement for a texting service, a personal admission in a TV interview, but taken together they trace a fairly consistent decade-long arc, starting from a deeply personal place in 2016, expanding into concrete, measurable infrastructure like Shout, and increasingly reaching demographics, farmers, football fans, men broadly, who statistically engage with mental health support the least. It's also worth noting what's changed about how William talks about it. In 2017, his public language was mostly aspirational. Treating mental health with the same respect as physical health should be the norm, he told a gathering of health writers that year, calling the UK's suicide rate among men under 40 an appalling stain on our society. Nearly a decade later, the language has shifted from calling for change to describing his own experience directly, a small but meaningful shift from advocate to participant. Mental health work rarely produces dramatic headlines the way a state visit or a coronation does. There's no balcony moment, no ceremonial robe, no single dramatic announcement. What William has built instead, across nearly 10 years, is something more incremental. A 24/7 crisis text line that's now facilitated 3 million conversations. A football campaign reaching stadiums full of men who might otherwise never discuss it. And a rural counseling program reaching farming communities that mental health policy has historically overlooked. It's also, in its own quiet way, a preview of the kind of king William has signaled he wants to be, less bound by the instinct towards silence and composure that shaped previous generations of the family, and more willing to treat emotional honesty as compatible with, rather than a threat to, royal duty. None of it fits neatly into a single news cycle, but stacked up year after year, it's become one of the more substantial, least flashy parts of what William has actually spent his working life building, long before any of it required a crown. Thanks for watching. Subscribe for more royal updates.